My stress test was normal. Why, 3 weeks later, did I land in the emergency room? And lo and behold, I had a heart attack. This question, or one very similar to it, is a question I get many, many times, very often. In fact, when I worked in the hospital, we knew an individual could have a normal stress test and we might see them back in the hospital in the next few weeks, the next 6 months, the next year with a heart attack. And usually that's the first thing they say. I just had a stress test and it was normal. Why now are you telling me I had a heart attack? One of the main reasons is that we're using that test inappropriately to try to predict if someone is going to have a heart attack in the next day, the next 24 hours, the next week, the next 6 months. The stress test has some benefits, but to use it to determine if you're headed for a heart attack today or tomorrow or next week or within the next year is not the best use of that test in most cases. So if you had a heart attack and you had a normal stress test, my answer to you would be, we have to look, we have to do different tests. We have to do more powerful tests that can tell us, now that you've had the heart attack, was that the only problem? And does that area look fine now? And are you still at risk for another heart attack because your arteries that give the blood supply to the heart are not becoming healthier? In other words, if you've had a heart attack or if you're concerned about a heart attack, you need to not only have the right test, but you need to have a complete test panel. You need to have a complete workup so that we can identify if you're headed towards a heart attack or not. Most importantly, how are we going to reverse that? And we can reverse that by looking at all of your contributors and just addressing them one at a time and reversing this process. I'm Dr. Gina Pritchard, owner and founder of the Prevent Clinic. Please contact our office for more information.